Hi, my name is Dr. Sumara Rashid, and today we will be talking about the dental healthcare team, which is Chapter 3 of your Modern Dental Assisting Textbook, Edition 13, from the authors of Bird and Robinson. The dental healthcare team basically consists of the dentist, the dental hygienist, the dental assistant who's trained on the job or who's formerly educated, the dental laboratory technician, and support services. The dentists themselves have a college degree, and usually it's a 4-year postdoctoral education. The emphasis is on basic sciences. The dental admission test, or the DATs, is the written examination prior to admission to dental school. 4 years are necessary to become a general practitioner. There's a master's or a PhD program in a specialty from 2 to 6 years, depending on the specialty that they are a part of. A dentist basically is trained in the United States of America and must graduate from an approved dental university by CODA, or the Commission on Dental Accreditation of the American Dental Association. So it can't just be any program, it has to be a program that has been CODA approved. And a dentist is either awarded a DDS, Doctor of Dental Surgery, or a DMD, which is a Doctor of Medicinal Dentistry, depending on the dental school that they come from. Certain states provide a DDS degree and certain states provide a DMD degree. For example, New York grants a DDS degree to their dentists that graduate, while New Jersey provides a DMD degree to their dentists that graduate from their dental schools. The dentist must take a written exam and a clinical exam in the state in which they choose to practice. Part 1 and Part 2 are written exams taken while they're in dental school. There's also something called a clinical board exam that has to be obtained for licensure in the state. Some exams are multi-state and some exams are only for a specific state. The dentist, while still speaking on the subject of the dentist, the professional organization that they could be a part of would be the American Dental Association, or abbreviated as the ADA. Their responsibilities include, which are present on page 20 of your textbook. I also put a little bit of a few cutouts, inserts here on this slide as well, just so it's easier to look at while we're talking about this. They're basically legally responsible for the care of the patient, and they assess the patient's oral health needs. It uses up-to-date diagnostic skills, and they use current techniques. They provide legally required supervision for the dental auxiliaries. So here, to the middle of the screen, you'll see the roles and responsibilities of the dental healthcare team members. You'll see the dentist at the top, the clinical dental assistant in the middle, the EFDA, and then the dental hygienist all the way at the bottom. And you can go ahead and look at those a little bit more in detail. But specifically, since we are talking about the dentist, they use current techniques and provide legally required supervision. Now, I know many practices, I know that many dental assistants or hygienists say, I don't have to worry about it. It's the dentist in the end that is responsible. That used to be very, very true in the past. However, nowadays, as time has progressed and lawsuits have been increased, unfortunately, in many practices, it's really imperative that the dental assistant know that when a patient or anyone decides to take some sort of legal action, for example, against a practice, they not only provide legal action towards the dentist or the provider, but they also can provide legal action towards the dental assistant, the dental hygienist, the entire practice. So it's not just one person, a lot of times it's everyone. And it's really important that the dental assistants with the dentist and dental hygienist be a very important team, that everybody come together and have teamwork, like we mentioned in the few chapters before, so that such things can be avoided. Open communication is always key, following HIPAA matters, and always making sure that the patient understands what they're getting done, and you understand yourself what you have to do and what your roles are. On the right, you'll see a little bit of a different kind of dental assistant, a business assistant, administrative assistant. You can call it a secretarial assistant or a receptionist. These are also performed by dental assistants as well. They greet patients, answer phones, they make and confirm appointments, they manage patient records, payroll, insurance billing, the finances, they make sure the privacy measures are in place, and they oversee patient relations. There is actually dental laboratory technicians as well that, that could be dental assistants. And they perform the laboratory work only under the licensed dentist prescription. So it's not like, okay, hey, look, I need a crown. Here's the mold, or here's the impression. Go ahead and make me the crown. No, there has to be an actual licensed dental prescription pad that they fill out, sign, and provide the laboratory with that. The technician construction or repairs the prosthetic devices based on what the prescription says. And they make such things as crowns, bridges, inlays, veneers. The dental hygienist in the middle of the screen, I wanted to just make sure you know, they overall assess the periodontal status of the patient, the conditions of the oral tissues. They go ahead and perform what they call the prophies, or the prophylaxis, which means they remove the plaque overall from the roots and the crowns. And they do something called scaling and root planing procedures. They expose radiographs, they evaluate radiographs, they perform additional procedures such as administrating local anesthetic, like numbing medicine, and also nitrous, the gas, if it's allowed by the state. If you go on to become the expanded function dental assistant, the EFDA, they perform only those intraoral procedures that are legal in the state in which they can practice. So you do have to check with the State Board of Dentistry as to where you locally are in terms of what is allowed. There are quite a number of dental specialties for the dentist to be a part of and to participate in. And it requires, like I said before a few slides ago, it does require a few years of extra training after they participate in dental school and receive their dental degree. Some of the dental specialties they have, which are including are 10 of them here, and they're also directly listed in your textbook as well, is prosthodontics, oral and maxillofacial surgery, oral and maxillofacial radiology, endodontics, periodontics, pediatric dentistry or pedodontics, orthodontics, oral and maxillofacial pathology, dental anesthesiology, and dental public health. Prosthodontics more specifically, I put a little diagram or a picture from your book right here so that you can kind of grasp the situation in terms of what they deal with. Prosthodontics involves the restoration and replacement of natural teeth with artificial constructs such as crowns, bridges, and dentures. Now, this doesn't mean that a general dentist cannot perform these. It just means that extra training has been provided to this specialty such that the dentist can perform difficult cases as well as the normal prosthetic cases. In this case, this is a prosthetic, normal, pretty much standard case to your right. But it depends on the dentist. If they find that the case may be too difficult or it's just a personal preference, that they refer all their prosthetic cases out to a prosthodontist. So it depends. And you'll notice that when you go out into your externships or internships, you'll see the difference in preferences. This dental specialty involves the diagnosis, the treatment planning, the rehabilitation and maintenance of the oral function comfort, the appearance and health of the patients associated with missing or even deficient teeth. And there's basically two categories. There's fixed prosthodontics and removable prosthodontics. Fixed prosthodontics is what you see here to the right. Fixed means that it's not going anywhere. It's fixed, it's cemented in or screwed in, whichever the case is, but it is set in place and the patient is not supposed to be removing it on a daily basis. This is an example here of a removable prosthetic or a removable prosthodontic. At the top, you'll see a partial denture. It consists of clasps and hooks, and those hook onto the existing teeth of the patient, and it is supposed to be removed at night. The one on the bottom is a full denture. This denture is a complete replacement of all the complement of teeth. If you notice, there are no metal components to it. There is no metal ring and no clasp because there would be no teeth that the patient would have. And this type of denture would have to be removed at night. It would have to be cleaned. And of course, there's special situations. There could be metal implants in the gums that maybe the prosthodontist has placed that has a magnet that helps to retain this denture that would have a magnet. I mean, technology has come so far, and there are many innovative products that have come about when it comes to prosthodontics. Periodontics. This specialty involves the prevention, diagnosis, and treatment of diseases of the supporting and surrounding tissues of the teeth or their substitutes, like implants. On the right, you'll see an implant that has been placed into the bone, and the gums have been placed, or the gums have been guided up along the abutment of the tooth. In the end, after the screw is placed in the bone, and I'm assuming this is after several procedures, the crown is permanently placed on top of the screw, okay? And that's what's known as the superstructure, okay? So the periodontist can go ahead and place the screw inside the bone, and a prosthodontist can go ahead and place the crown on top of the implant that has been placed. Again, this doesn't mean that a general dentist cannot do this. Definitely a general dentist can do this. It's just a matter of the fact that periodontists and prosthodontists have had special training, additional training since graduating dental school, and they have additional schooling as well. The oral and maxillofacial surgeon. This surgery involves the diagnosis and surgical treatment of diseases, injuries, and defects of oral and maxillofacial soft and hard tissues. It consists of much more than just tooth extractions. You've probably heard of cases where some patients have cleft palates, like a split lip a little bit, and those cases, an oral surgeon can go ahead and reconstruct or quickly fix. So the example on the bottom consists of a photo of an impacted wisdom tooth. And if you can see it's tilted, there's no way it's going to be erupted. So oral surgeons also remove those, in addition to the routine dental extraction, which you see in the picture at the top. Endodontists are basically dentists that perform a lot of root canal procedures, and you probably have heard of them, or maybe you've had loved ones that have been referred to endodontists. It involves the cause, diagnosis, prevention, and treatment of diseases and injuries to the pulp and associated periradicular structures. The common term for treatment of a tooth requiring endodontic treatment is called root canal therapy. And if you look at the picture to the right, you'll notice that the regular tooth, which is in step 1, has their nerve that's in pink, and you'll see the top, which a cavity has now invaded the nerve, and you'll see all the way at the end of the root, you'll have this little, I guess you could say, ball, and that's more of an infection. So when that happens, the cavity has contaminated the nerve. And in this case, a root canal has to be performed, whereby the nerve is removed or excavated, and then a medicine type of area, a medicine is placed, and then a fake nerve is placed, and hence calling it a root canal or root canal therapy. And then finally, usually a crown is placed or a large filling is placed. Orthodontics and dentofacial orthopedics involves the diagnosis, treatment, interception, and prevention of malocclusions of the teeth and skeletal abnormalities. Basically, it's much more than simply fitting of braces. These type of dentists place also retainers as well. They can also place fixed retainers and removable retainers. So if you see to the right, you'll see a lot of brackets, and then you have the wires that interconnect between each bracket, okay? And when you have, I believe, chairside assisting next semester, you will see how they look up and close, and you'll be actually assisting with setting up trays for orthodontists to help them in placing these brackets and wires. Over a course of time, the wires and brackets get tightened such that certain malocclusions are fixed or corrected. Pedodontics or pediatric dentistry, and it's really an age-defined specialty that provides primary and comprehensive preventive and therapeutic care for infants and children through adolescence, including those with special needs. The pediatric dentist or pedodontist often treats children with emotional and behavioral problems and those with physical disabilities and mental impairment. Again, this is not to say that a regular general dentist can't treat these patients, or a lot of general dentists can even do oral surgery, and many periodontist surgeries and orthodontist surgeries with just additional training, but any general dentist can do it. But it just goes to show that when it comes to pedodontists, that they have extra training and extra certification or actual certification that they can do it. Oral pathology basically addresses the pathology or the oral structures with identification and management of diseases of the oral maxillofacial regions. It's basically a science that looks into the causes and processes of diseases. It also diagnoses the diseases using clinical, radiographic, microscopic, biochemical, and other examinations. It's very detail-oriented. A major function of the oral pathologist is to perform biopsies and to identify diseases through microscopic examination of cells and tissues. So it's not just looking in the mouth, they also go ahead and take certain types of biopsies. And then they take those biopsies and they could subject it under the microscope. Again, these oral pathologists deal with lots of benign and malignant cases, such right here in the picture to your right. And then you have the oral and maxillofacial radiologist. The dental radiologist uses new and sophisticated imaging techniques to locate, diagnose diseases or disorders and conditions of the oral and maxillofacial region. One of the newest, it's considered as one of the newest recognized specialties in the last 36 years. And it was granted recognition in '99 by the American Dental Association. So overall, it's pretty new. Dental public health is the science and art of preventing and controlling dental diseases and promoting dental health through organized community efforts. And the key word here is community efforts. It involves the development of policies at county, state, and national levels for programs to control and prevent disease. Examples include things like water fluoridation promotion, dental health screenings. I'm sure you all have heard of Mission of Mercy, Give Kids a Smile, which you will all be a part of soon, come time this spring, and dental health fairs. Overall, all dental specialties require additional training beyond dental school and a national board examination to practice their specialty. The dental hygienist, we're going to now go into this part of the dental team. The dental hygienist is a licensed professional with specialized clinical and educational skills. The minimum education you might have heard, we offer it here, is 2 years of academic and clinical study in an ADA accredited dental hygiene program, receiving an Associate of Applied Science degree. Students can also attend a bachelor's and master's program for dental hygiene, completing their 4-year degree and a master's degree. But they must pass the National Dental Hygiene Board exam and regional professional licensure boards to earn the title of registered dental hygienist. You have to work under the supervision of a licensed dentist, just like the dental assistants. The professional organization, which is called the ADHA in this case, the American Dental Hygienists Association. Over here to the right, you'll see a dental hygienist performing an oral prophy or a cleaning, and this is taken straight from your textbook. Okay, same photo as before. So when it comes to the dental assistants specifically, excuse me, graduates from accredited programs are eligible to take the DANB, or the Dental Assisting National Board exam that we talked about before in the last 2 chapters, and they are formally trained in chairside assisting and expanded duties in the dental environment. This exam is recognized by all 50 states. Formal education is 1 academic year, resulting in a certificate on completion of the program. And our program is definitely accredited by the ADA and by CODA, which oversees our program. And CODA evaluates the programs to make sure that we're in compliance by the ADA. The CODA oversees all accredited dental programs in the US, dental schools and postdoctoral programs, dental hygiene, and dental assisting. The dental assistant education, let's talk a little bit about that, just like it's a little bit of a wrap up from before, but it's important to touch base overall. Basically, it's an education you take after high school, so it's post-high school. Minimal standards for schools accredited by CODA, Commission on Dental Accreditation, must be met. The studies must include didactic, lab, and clinical experience. The dental assistant can also receive training in a vocational setting accredited through the state's Board of Dentistry. Some of the responsibilities of the dental assistant include, but are not limited to, seating and prepping the patient, charting, overseeing infection control procedures, mixing and passing dental materials, chairside assisting, exposing and processing radiographs, performing lab procedures, patient education, post-op instructions, ordering dental supplies, ensuring compliance with OSHA regulations. So there's a lot of duties involved. Of course, we're going to break this down little by little as the program goes on, but it's important to make friends with just the overall duties as is summarized here. Expanded function dental assistants are abbreviated EFDAs. The delegation of expanded functions kind of varies from state to state in which the dental assistant is employed. It depends on the state's Dental Practice Act, wherever you go, and it's important to be aware of the laws of the state in which you practice. The delegation of the following function varies from state to state depending on the state's Practice Act, like I mentioned before. For example, they could be placing dental sealants, they could take impressions, they can actually make temporary crowns and bridges, they can place retraction cords, which a dental assistant, the two expanded function can do. They can apply fluoride, topical anesthetic, they can place and remove dental dams, they can place liners, varnishes, and bases, they can carve and finish silver fillings called amalgam, composite fillings. They can remove sutures or strings. They can also place and remove periodontal dressings as well. The employment opportunities are really what's very good. You can always work at a general practice. Okay, lo and behold, definitely. Specialized areas of dentistry as well. All those specialists, public health. You can work at a hospital dental clinic. You can go even into education. You can go into practice management, insurance companies. You can become a dental sales rep, or even go into oral healthcare industry as well. The dental laboratory technician, you can also go into becoming a dental lab tech. So, and that can only legally, they can only legally perform those tasks specified in the written prescription from the dentist. Individuals who wish to become a certified dental technician, a CDT, must pass a written exam though. So a professional organization in this field is called the American Dental Laboratory Technician Association, ADLTA. And to the right, you'll see a picture of a whole bunch of laboratory cases that are stored in what's called work pans. And the dentists have a written prescription, and you can see them kind of posted on each work pan. And what the lab technicians do is take each work pan based on when they got the order or when they're due, and they would go ahead and fabricate the case and then deliver or mail them to the practice. The dental lab tech education is a 2-year education program often undertaken, but it is not required to have formal education, believe it or not. In a 2-year program, one may obtain their associate's degree. There are approximately 30 programs in the United States. Education may be obtained through apprenticeships, commercial schools, or ADA accredited programs, which are usually 2 years. The technician must pass a national exam to earn the credential of a CDT. Okay, here they are busy at work. You can see the dental lab techs with their instruments, and they're there, and they're, somebody's over here looking at the prescription. Someone's taking a drill and, fabricating something on the model. So, it's busy, busy, busy. And you can see the whole slew of the prescriptions that they have. They're pretty busy people. There's also dental, supporting services rather. So the dental supply person is a rep from a dental supply company that routinely calls on dental offices. The detail person is a rep of a specific company who visits the dental offices to provide information concerning a particular product in that company. And then, of course, there's the dental equipment technician. That's a specialist who actually installs and provides service for and repairs the dental equipment. We often see that in our clinic here, in the hygiene clinic. Over here, what they do is they're always coming out if the chair broke down, if one of the students is like, the water's not coming out, it hasn't been working for weeks. You'll often see, I believe it's Henry Schein or Benko, 2 services that sometimes we use in repairing some of the equipment. No matter what, overall, I encourage you all to be the professional you want to be. it's very easy to say, yeah, I'm just going to do this and I'm just going to do that. That's it. I'm going to call it a day. But remember, if you want to take your career, seriously, be the professional you want to be. Go all the way, and just I cannot encourage that anymore. And keep learning. Thank you.